Margaret Mead said that we need to make dramatic personal or professional changes every decade. And as I look at my professional life, I absolutely have done that. So I really encourage students to look beyond traditional roles and beyond traditional expectations. I was attracted to nursing because I worked as a volunteer in a hospital. I was very interested in helping sick people become better. I looked at the different roles that I saw people playing in the hospital, and it seemed to me that it was the nurses, in fact, that really knew the family members, really got to know patients.
I met Kathy one evening at the UCLA hospital when I went to visit a student of mine who was ill there, and Kathy was his nurse, and I was enthralled. I found Kathy very intriguing. In time, we got to know each other better and fell in love. We got married a year and a half later. I think what drives Kathy is her love of her profession. She just really enjoyed nursing, and I think she wanted to be one of the best in the career, and she certainly has.
Kathy has had an extraordinary professional career in her research. She has published over 400 articles, and that is a major accomplishment to publish 400 manuscripts. However, that really means that she has collaborated with that many people, touched so many lives through her research.
Kathy's master's expertise was as a psychiatric nurse specialist, and then she got a doctoral degree in cardiovascular nursing, but she brought to the field that emphasis on psychiatric nursing. And so she spawned a whole family of researchers that are very interested in how people feel about having cardiovascular disease, being at risk, and that's really shaped nursing in cardiovascular disease.
One of the biggest results of Kathy's research with cardiac patients was helping them to improve their own health by adhering to medication regimens, by improving their health behaviors, which really helped them to be able to stay home and out of the emergency department and out of the hospital.
When I came to UCSF as dean, there was tremendous pressure to grow our student body, as well as, of course, to meet the mission of UCSF in terms of research. Over the 10 years that I was dean, the number of students increased to approximately 750, which was a 40% increase of students.
Kathy was able to build many bridges with the medical center by serving on the Chancellor's Executive Council. But the second thing that she did that was probably most prominent were the nursing rounds that she developed. This was a very important form of role modeling that she did not only for the faculty in the School of Nursing, but also for the nurses in the hospital.
I've had the privilege of guiding a number of doctoral students and postdoctoral fellows. It has been a marvelous experience because of their talent and commitment.
One thing about Kathy is that she will never tell you what to do. I would ask her what I should do, and she would say to me, only you know what you want to do. And it's that kind of person that helps you search your own soul.
I always think about Kathy when I'm coaching doctoral students or anyone. When I'm interacting with another human being, I think to myself so often, how would Kathy do this?
Kathy is one of the warmest and most personable people. She has a great sense of humor, but she also has a wonderful habit of talking with people as if they are the only person in the room.
The privilege of teaching these students has been to watch them grow and meet challenges that perhaps even I have not met. So the excitement of the future is really with the students that I have taught.